So in this video, we're going to take a look at imaging the midface with the VINNO Handheld Ultrasound unit. And let's review the anatomy of the midface that we're going to be able to see with the ultrasound. So we can see the piriform space just medial to the nose. We'll also be able to see the major muscles, the LLSAN, the LAO, and on top of the LAO, we usually see the LLS. We'll be able to see the angular artery. We'll be able to see the infraorbital artery, and we'll also be able to see the angular vein. There are some fat compartments that we'll be able to see with ultrasound, so we should be able to see the nasolabial fat superficially and the deep medial cheek fat. We should also be able to see the superficial medial cheek fat as well. And with the bone, we'll be able to see the maxilla and the infraorbital foramen. So let's take a quick look at the anatomy on this video here. So as we zoom in, I'm going to point out these things. So this is our LLSAN muscle. We've got the LLS just lateral to that. Deep to that, we've got the LAO. And some of the other important structures here, we've got the angular artery and the angular vein. We might be able to see a little bit of the nasalis muscle. Deep to everything is the maxilla. The zygomaticus minor muscle does come in here as well, but sometimes it's a little bit too lateral to see on ultrasound, so we might not pick that up in some of the views that we take of the midface. Now, taking a quick look at the cross-section here, because this is the view that we're going to get on ultrasound, as we're a little bit lower in the midface here, we're going to be able to see the LAO muscle and the LLS muscle sitting just above it. So we're a little bit lower here than where the infraorbital foramen is. And just lateral, you might see the zygomaticus minor, you might not. Medially, you'll have the nose, and we'll probably be able to pick up the angular artery and vein there. As we come a little bit higher on the face to where the infraorbital foramen is here, and this is a really nice landmark that you can use when you're scanning, so it's this little gap that we're going to have in the bone, we'll be able to pick up the infraorbital artery, and superficial, or just above that, is going to be the LLS muscle. And we might even see some of the orbicularis oculi muscle as well. And now not shown on this image is the superficial fat layer. So we might see the nasolabial fat in here, and you might see the superficial medial cheek fat around this layer over here as well. And of course, we're going to have the epidermis and the dermis tissue here. So let's take a bit of a look at that same image here on ultrasound. So we're going to have the transducer going transverse across the mid cheek here. And to the right hand side of the screen here, this is going to be the nose. So this section here is the nose. This is the lateral part of the cheek. So this bone that you can see along here is the maxilla. At the top of the screen here, you can see this is the angular vein. So you usually see the angular vein a little bit more superficial. And we're a little bit higher up on the cheek. So in this case, we don't actually see the angular artery, but on some people, you might see the angular artery somewhere in here if you're a little bit lower on the cheek. We can actually see some of the muscles here. So this is the LLSAN muscle, the superficial part of that and the deep part of that as well. And our LAO and LLS muscles should be around this area here, and this is going to be our superficial medial cheek fat in this compartment here. So let's just play this video and we'll have a bit of a look at this in live imaging. So you might have just seen a moment ago down the bottom here we have the infraorbital artery, so that's going to be the infraorbital foramen down there. We can see parts of the angular vein. This is the nose off towards this side. There you can see that vein again. So if we were to compress here, you'd lose that vein, so you've got to be careful of your pressure. And as we're scanning around again, you'll just see, as we're kind of moving up and down the face and tilting and rocking the transducer, you'll see that there's that infraorbital notch, but you'll see that infraorbital artery come in and out of view. So let's now take a look at the sagittal view. So now we have the transducer oriented like this. Just medial of the nose, you can see that this marker here is the left-hand side of the screen, and the bottom of the transducer, the right-hand side of the screen, is going to be the lower part of the face down here. and we're running directly over the angular artery and the vein. So in this image here, the angular artery and vein basically overlap. In real life on this person, they're a little bit separate. So what we're going to see here is the angular artery. This is the maxilla. So this is up towards the eye. So this is pointing up towards the eye here, and this is down towards the lip. I'll point out a couple of things before I start the video. So this darker layer on the top is running along like this direction. That's our nasolabial fat. Then we have, we're going to see the LLSAN muscle here and down here. And this is going to be our deep medial cheek fat around this area here, just above the bone. So let's play the video. All right, so we can see the angular artery there. This is the maxilla. As we tilt and rock, you're going to see some dark area down here. That's going to be the Pyriform Space. So we're just picking up that angular artery there. We've just changed the angle of the color flow box just to line it up a little bit better with the angular artery. And we just saw those LLSAN muscles coming into view really nicely there. But this is the Pyriform Space down here, this black area that you can see. And now let's move just a little bit more lateral on the cheek. So I've just moved the transducer from here over to here. And as we play this video, we're just going to see those slightly more lateral structures, so the LAO and the LLS muscle. Okay, so we're starting in the same position here. So as I just pause it there, this is a really nice view of what that LLSAN muscle is going to look like. As we come a little bit lateral, you lose the piriform space, so you don't see that dark or that black or the anechoic structure down here anymore. Let me just play this again. And we're starting to come lateral. And as we come lateral here, I'm just going to pause it now. You start to see these two muscle bellies. So this deeper muscle belly, which is kind of divided by this white connective tissue here. This is the LAO muscle. And then superficial to that is the LLS muscle. And again, you can see that superficial cheek fat in there. Let's just keep playing that video. And up around this area again, we're going to see that little reverberation down there. That's the infraorbital foramen, and that's the infraorbital artery on top of it. You can see the fat compartment. That's our angular vein. So our angular vein is found all the way over there in this case, so a little bit more lateral than what you can see it on the picture. And you know it's the vein because it's easily compressible, whereas the artery down here is not. So that's often where you'll find that facial vein or angular vein superficial to the infraorbital foramen there.